Another big story we are following for you tonight. A CDC panel has endorsed Pfizer's COVID-19 vaccine for kids as young as 12, clearing the way for shots to start as early as tomorrow. The doses and the scheduling of appointments for the first and second shots are said to be the same as they are for adults. Here in California, MyTurn.com is expected to release appointments to the younger age group beginning tomorrow.
That's noteworthy. COVID vaccines will start to be administered to kids at the San Francisco City College vaccine site this weekend and at UCSF Benioff Children's Hospital in Oakland on Monday. KRON 4's Zeke Madune spoke with a Bay Area pediatrician about what parents need to know before taking their kids to get the vaccine.
Now that a CDC advisory committee and the American Academy of Pediatrics both endorse using Pfizer's COVID-19 vaccine for kids 12 to 15 years old, what do parents need to know if they're planning to get their children vaccinated? Dr. Lionel Herrera is a pediatrician at San Ramon Regional Medical Center.
The main things you need to know is the Pfizer vaccine was just approved for kids between the age of 12 and 15 after a study proved that the vaccine was safe and reliable in children.
It is important to note that in the state of California, a parent or guardian must be present to give consent that a child can be vaccinated.
Someone would need to give the parent a brief about the vaccine, and then the parent would have to sign off that they understand that there's risks and benefits to the vaccine.
He says the study shows that the side effect profile for a child is similar to adults who get the vaccine, including injection site pain, fever, and fatigue.
And there was more fainting noticed in that group, and so there is going to be a precaution for the kids to be watched carefully after they receive their vaccine.
Health professionals say children getting the COVID-19 vaccine may help alleviate some of the anxiety about children being the carriers of the virus when they return to their classrooms in the fall. However, vaccine hesitancy remains an issue. Dr. Herrera talks about the results of a recent study.
Only about 30% of the parents would give their children the vaccine without any hesitancy. And I think with education and knowing now that we have these studies that are showing that it is safe and effective in children, with a little bit of education, we'll be able to increase those numbers.
Zeke Madune, KRON 4 News.